COVID Talks continue this afternoon with Dr. Amanda Novak from Baptist Health. Thank you so much for joining us today, Dr. Novak. We always love seeing you. And we'll start with a question that we've been talking about all day in the newsroom. Doctors recently announcing and the FDA announcing that they will eventually allow mixing booster shots. Can you explain the reasoning and what we need to know about this?
Right. So I think the truth is most of these studies come out of some amount of necessity. So we know that early on in Europe, there were people got AstraZeneca and then didn't want a second dose of AstraZeneca, so would take an mRNA vaccine. And all over the world, there's been situations like that, either because of side effects or just because of availability of vaccines. People all over the world have been mixing these vaccines. And what the FDA has found at looking at what evidence they have is that that's probably reasonably safe. And so that's the big thing, is that it's not so much a recommendation to mix vaccines so much as it's allowed. The one exception is with Johnson & Johnson's vaccine. They found that if you get a second dose of Johnson & Johnson, that boosts your immunity about 4 times, which is great. That's very effective, and we like that. But if you give an mRNA vaccine, so either Pfizer or Moderna, then it boosts the immune system dozens of times more than that. And so for people that got J&J originally, it might be recommended that they mix vaccines. Otherwise, it's probably just going to be allowed based on convenience in your situation.
And, with all of this changing and new recommendations or new allowances at this point, do the same guidelines still apply for the booster, talking about the time needed to wait in between shots?
Yeah, so good question. And the truth is, who knows? I mean, the CDC and the FDA have kept us on our toes when it comes to this. But it looks like probably the recommendation for boosters for Moderna are going to be just like the Pfizer. So 6 months after your second dose, then you can get a booster of Moderna. It looks like for the J&J vaccine, a second dose will actually be allowed as early as 2 months after the first dose. So a little bit of difference just to, again, keep us on our toes. It'll be a little bit nuanced, but in general, this will fall in line with what we've talked about with boosters before, which is separate from that third dose that we give to immunocompromised people.
And where do we stand right now when it comes to the timeline of kids ages 5 to 11 and when they could receive that vaccine?
Well, I will say that kind of behind the scenes, people are saying get ready. So pediatricians' offices are already getting details about what it will look like when these distributions go out and what the allocations will look like. The FDA will meet at the end of October. So I think October 29th, they'll get together and make some recommendations about whether or not it's the EUA, the emergency use authorization, will allow the vaccination of 5 to 11-year-olds. And then it'll actually be November 2nd and November 3rd that the CDC comes along and kind of puts the rubber stamp on that. This dose will be different than the dose we've been giving so far. So it's a different dose and it's a different concentration. So you can't just give a half dose of what we already have in the refrigerator. So they'll have to distribute these pediatric vaccines all over the country. So that delay hopefully will time out where once they're approved, we'll be able to get them in the arms of our school-age children as quickly as possible.
Wow. Well, thank you so much, Dr. Amanda Novak, joining us live from Baptist Health. We appreciate you as always.